Cataracts remain the leading cause of blindness in South Africa and the world over. According to the WHO, cataracts are responsible for 51% of world blindness. As people in the world live longer, the number of people with cataract is also anticipated to grow. In fact, by the age of 80, most people will either have had cataracts or have had cataract surgery. It's for that reason that cataract surgery is one of the most common operations worldwide. The period September 23rd to 18th of October is Eye Care Awareness Month, and the 11th of October was World Sight Day. So today we discuss cataracts, and we're joined in studio by the head of ophthalmology at Helen Joseph Tertiary Hospital, representing the National Department of Health. We'll also have an ophthalmologist and president of the WOC 2020 and a surgeon from Steve Biko Academic Hospital who himself has had cataract surgery and will share his experience with us. Now, be part of this show by asking the panel some questions or simply just sharing your views with us. The number to call is Johannesburg 714-5861 or 5877. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show coming to you just after a short break. I'm Dr. Salome Daung, and this is Health Talk.
Ekaba di jara nyana tse ka bang bo 2 years a ke be ya lokentse ke le slow ke utlwa gore le tlho matlhwana week o kile wa bona ke nakonyana e telele. As I say, ha se ntwe ya speed wa ikutla la o tsamaya gore matlhwa ga gwantsa nna week.
Mehemina Masike from Soweto, who's passionate about sewing, says losing her eyesight was traumatic.
Hak tshwantse ke somele nna lete hey ke tshwantse ke shebero ba kai ke ne ke re somelang nna ke mesa ho all the time next door in ke tlalwana le nna lete for 15 minutes.
Besides not being able to do what she loves, Masike experienced strange things that made her realize that her eyesight was disappearing.
Ke bona gore go setla o ka re go na le musi mo ntle. Ke bona musi bo setla. Go sena botlhoko, go sena pain, go sena nix. Ke bona fela ro ke bona bo setla mo letsatsing ha le bright yana go setla mo ntle. O ka re go kweleditswe di tlhaga di omang go nna go setla marebe ke bona ile gore bo setla bo ya no ka re bontse bo nna worse.
By the end of 2018, Masike realized she had no option but to go to hospital where her first surgery on her left eye was done.
Ke ile go sepetlele ko ka le tlhogonolo lona le itlholo la number 1 operation la nna perfect. Ko operatilwe ke ngwanyana wa doctor o monyane ke re ke tla bona teng ko Tsenjono go tletse nkenkenyana ka re ke tlile ke tshwantse ke etse se ba reng ke setse and so far ke batla le itlhole loke ha ba mpitsa ke itlisitse ba ngo operatile ge le itlhole la number 1 la nna right 100%.
This year, Masike had to go for the second surgery for her other eye.
Le operatile mbonchale le ntse le bona weaker than that old operation. So ha ke tsora le tla improve or le tla dula le jwalo. I don't know. Mara hali as bright as the first operation. Ya ka ke riano why ba sa re fe di rights tsa gore ha o fitla ko sepetlele o re ke batla operatwa ke Dr. Mokete ke ta ke re ba sign le mo file o re ke kopa go operatwa ke Dr. so and so ya ka irile la pele a feleletse mosebetsi wa gagwe a ke ra ne ba re fa di rights tse yana ha re itse gore maybe ba na le lebaka mare lebaka la bona ha le re berekele ka re yana gore as patient re tshwantse re tshoge gore yana o tla la bobedi o tla etsa tsona na.
Masike seemed to have a valid reason for her frustration with the second surgery.
Tato o irile leitlho le 3 times at the end of the day e gone yana ebile se ba rona le glaucoma All right, o na le sukiri nna ke na yona, but you can never know. Phela taba ya leihlo it's a very complicated something. How you have the operation go wa tshoga. And ntse o ba bona batho ba foufetse motho a re ke irile di-operation ko kae a foufile rona re ba bona ba mo operatile ko habone ba sa ira ko St. John ba irile kae o mo irile kae taba bo fofu a se ha ba ke a special place. You can be blind from anywhere.
But nonetheless, Masike is happy with the outcomes of all her surgeries.
Bo right ka rena ke tlo pain a gona botlhoko a gona pain.
All right, so we get into the subject of at least the topic of today, cataract, and let's learn more from our special guests. It's a great pleasure to welcome, first up on my left, Dr. Kerry Alberto, who's head of ophthalmology based at Helen Joseph Tertiary Hospital, and of course she's representing the National Department of Health. Welcome to Health Talk.
Thank you very much.
Alberto. And of course we have Dr. Kaule Khodi, who's an ophthalmologist based in private practice in Pretoria at Medforum, and he's also president of WOC 2020. Welcome to Health Talk, Dr. Khodi.
Thank you.
Perhaps let's just stay with you. When I introduced you, I said you're president of WOC 2020. Can you just briefly tell us what this is about?
This is about, we call it World Ophthalmology Congress.
Yes.
It's going to happen here in Africa for the first time since 1847. It will be in Cape Town, meaning that all the ophthalmologists in the world will be convening here.
Right.
And it's a good thing for us because this is the time whereby we'll be having a lot of ophthalmologists sharing ideas and changing ideas with each other so that we can also able to talk about the things like what we are going to talk about today, cataract.
Cataract, being the major thing affecting the world.
Causes of avoidable blindness.
Right, yes. right. Okay, that's wonderful. So let's come to you, Dr. Alberto. Now, perhaps before we start talking about, cataracts and what have you, I think it'll be wise if you just take us through what the normal eye is and where this lens is situated, so that at least we have a better idea. When we talk about cataracts, we know exactly what we're talking about. I see you have a model here. You're going to take us through what a normal eye looks like. Yeah?
Yes. Okay. So if I just show you from the side, this is the front part of the eye, this is the back part of the eye, the anterior chamber, the posterior chamber. This white thing here is the sclera, it's the harder coat of the eye. And joined to the sclera is the cornea, which is the clear front part of the eye, which is situated here. Now, if you look here, the lens is a shape like this. It's a disc, and it sits in the anterior chamber, but behind the iris. This small hole is the pupil, and when you dilate the iris, you dilate the pupil, you get a bigger view of the lens, which we can talk about later. The lens is suspended on these zonules, so it's like a trampoline suspended in the anterior chamber, which is filled with water. The posterior chamber is filled with vitreous, a jelly-like substance, which gives shape and turgor to the eye.
Okay, so what's the function of the lens then?
So 90% of the light that enters the eye goes through the cornea, which is a clear media. But 10% is refracted by the lens, and the light goes through the eye, through the media, and it is projected onto the macula at the back, where the signal goes via the optic nerve to the temporal lobe, to the occipital lobe of the brain, which interprets what you're seeing.
I see. So the message will go to the brain to tell you exactly what it is that you are seeing.
Exactly.
That image that is projected at the back of the eye.
That's right. The lens is also it's part of the visual system that refracts the light. So in other words, it focuses the light.
Okay.
But it's not the main one, but it has a very big part to play as well.
Okay. So without the lens, you cannot see.
No, you can see without the lens, but you're very much out of focus.
Right.
So if you take the lens out, you need to put in another lens to keep you in focus. And your lens power is different from each eye.
Right.
So yours would be different from mine, and so on.
Okay, so let's get to the subject then. What actually is a cataract?
So a cataract is a clouding of the lens. So normally your lens would be clear, but a cataract is a clouding. So basically your vision is affected because now you can't see through that white opacity.
Okay. Dr. Nakhodi, we in my introduction I said, I mean, cataracts are the leading causes of blindness worldwide. And in fact, you know, figures from the WHO put it at 51%. Do we have a sense of, you know, the incidence or how common it is in South Africa?
It's very common because it's something that everybody is going to have.
Right.
Because of, as Dr. Kira was just saying now, it's a cloudy of the eyes, and also, and it's goes with the age.
Right.
The older you become.
Well, talk about the age. Now, who gets it? I mean, at what age?
You know, we usually say we've got an age-related cataract.
Right.
It's a misnomer. We always think that it's only the old that get the cataract.
Right.
Cataract can be you can be born with it,
right,
and also it can be caused by diabetics, which is very common.
Yeah.
And also we've got types of cataract that we have what we call nuclear cataract, cortical cataract, or posterior subcapsular cataract,
right,
which we've got their models here.
Okay.
Then the incidence from WHO, you know, yes, is very high. They are thinking about 285 million people who are blind
because of cataract.
Of cataract.
All right.
You know.
So how will people know that, you know, I have a cataract? What are the typical symptoms? The
typical symptoms is blurry vision.
Right.
They cannot see very well, especially on the things that they used to do or used to see. Now this time they've got, like the mother who was talking the clip,
yeah,
that she's sewing. Yeah. Now suddenly she cannot put the thread into the needle. Those are some will say, I'm used to be able to read Bible. Today I cannot. Yeah. Or driving, I cannot able to drive. And by the way, if I can tell you that they made a research that if people can be removed cataract in the world, the rate of car accidents will also be low.
Okay. So I mean, this is quite a serious one. We're saying that cataracts could potentially be one of the reasons why we have, you know, a high accident rate.
Yes.
Apart from other reasons.
Apart from other reasons.
This is quite serious.
Yes.
Right. So what is the consequence there? We've just had one of it, you know, that of course people vision declines to a point where, you know, they are a danger on our roads. But what is the consequence of having a cataract, you know, done if you do nothing about it?
Well, there's no set time to do a cataract. If you have a cataract, it could be an early cataract, mid or late. Late would be something that looks like completely white and opaque, and then right, everyone can see it. But people have earlier cataracts. There's no set time, but the longer you wait at stages, yeah, it's the surgery becomes a bit more difficult.
Okay,
but that's
talk about
not
the
necessarily.
Yeah.
That's not necessarily.
I just wanted to get your sense. I mean, you're head of ophthalmology at Helen Joseph. What's the profile of the people that you see with cataracts? Is it older people, younger people, male, female? What's the profile?
Well, everyone will get a cataract in their life if they live long enough. But basically, it's older people that we see, right, diabetics. We also do have quite a lot of, not a lot, but we do get all the young babies that are born with congenital cataracts. We also see all the traumatic cataracts that get caused by blunt trauma to the eye or sharp trauma to the eye. And, you know, those are the kind of patients, so all through the whole spectrum, but mainly elderly people. Okay,
all right. The last question before we go for a break. We've heard of Vision 2020, and we do know that former President Motlanthe is ambassador for Vision 2020. What is this?
So Vision 2020 was started in 1999, and it's a global initiative to eliminate preventable blindness by the year 2020. And cataract surgery is a big part of the cause of blindness, preventable.
All right, okay, we're going to talk about cataract surgery a bit later on. Okay, but for now, time for a quick break. When we come back, we're going to learn the impact that cataracts can have on an individual, this time a professional working as a surgeon. Please stay with us. Welcome back. We're talking cataracts with Dr. Khao Lekhodi, and now we're joined by Dr. Remzi Maluleke. Now, Dr. Maluleke is a surgeon who's based at Steve Biko Academic Hospital, and of course, he's also in private practice at MedForum. Welcome to Health Talk, Dr. Maluleke.
Thank you.
And I placed you at Helen Joseph by mistake. I'm going to come back to you to learn about your story. But let's start with you, Dr. Lekhodi. You know, I think we started touching on it a little bit, the types of people that get cataracts. But let's look at the risk factors and the causes now for cataracts.
Okay. First of all, we all know that cataract is age-related. That's number one. The first 80% of people caused by that.
Yeah.
The second one...
So when we say age-related, from about what age?
Let's say
old age.
From the age of 40 going up.
Okay.
We're starting to have cataract.
Right.
And the second one that we are studying is people who are diabetic.
Right.
Very common with them.
Right.
Other one, as Dr. Kiri was saying, she was saying, trauma also causes cataract.
Right. Trauma to the eye, obviously.
Trauma to the eye.
Right.
Can be either accident or can be from radiation. You know, those are the things that can cause, or also the treatment that you're taking, especially when you take steroids, it causes cataract.
Right. What about social factors? I mean, going out, being out in the sun, alcohol, drugs, and that sort of thing.
Those are the other things that other causes. You know, I just wanted to the main ones that causes cataract. The other one, they just prevalence, the incidents that can increases the risk of getting the cataract.
Right.
Alcohol is one of them. Smoking is another one.
Yeah.
The sun, yes, but we usually say that the sun is, I mean, you may find that people who are in up there north, they've got a cataract, but some they don't. But they're on the same sun, you know.
Yeah.
Therefore, we have to look at why other people have got the cataract, why it's up there. But yes, the sun does cause cataract.
Before we speak to Dr. Maluleke, the one thing we haven't spoken about is actually what actually happens to the lens in the cataract. I mean, we said that it becomes opaque. Yeah. But what actually happens in there?
It's the increase of protein in the lens itself.
Right.
It keeps on growing and growing, and now it becomes cloudy.
Right.
And then it blocks the vision to the retina.
Right.
That's why now patient comes with blurry vision.
I see. Okay. Dr. Maluleke, you had cataract surgery. Just take us and our viewers through exactly what you went through, perhaps at the time that you were experiencing symptoms that obviously made you uncomfortable. Just share with us what you experienced before.
Yeah. Now let me begin by saying that I spent a lot of time in front of a computer.
Right.
I spent a lot of time reading, and I spent a lot of time looking after patients.
Yeah.
And as part and parcel of somebody like me looking after patients, I have to operate on the patients.
Right.
And the type of operations that I do require, they require that one should do the operation with military precision, with minimal complications.
Yeah.
And from that, you can tell that one requires good vision.
Right.
Without good vision, one can easily end up, with complications and so on.
Cut in the wrong vein or the wrong artery and that sort of thing.
Yes.
Yeah. Right.
So that was the main issue.
So you were struggling a bit with vision.
Yes.
But I suppose, as with most people, the first step would be to see an optometrist and so on. So what did you do?
Now, Dr. Lekhodi and I work at the same private hospital. So every time when I walked into the, doctor's room, I would meet him, and it would remind me that, by the way, there's this issue that we haven't sorted out, the blurry vision that I had.
Okay.
So
you had blurry vision, yeah?
Yes.
Yeah. All right.
So I actually struggled.
Yeah.
And so I decided, look, I have to sort out this issue as soon as possible because, as I've mentioned, the type of operations that I do require that one should have good vision.
Yeah, yeah. Perhaps at this stage, let's just, for the sake of our viewers, clarify this issue. There's the issue of blurry vision and the short-sightedness and long-sightedness.
Okay.
Let's just clarify that and so that our viewers are clear on that. What's the difference?
Blurry vision is when you cannot see very well.
Right.
And you don't need spectacles.
Right.
Even if you wear spectacles, you don't wear spectacles, there's no change.
Right.
Now, when you say somebody was short-sighted. We
Right.
call them myopia.
Right.
That one can be corrected by wearing spectacles.
Okay. Right.
You see, like the person who is short-sighted,
Right.
long-sighted, I mean, but cannot see things which are very, very near. I usually give you an example where, when you go to church, the priests like to put the spectacles like there. On top, you look at the congregation, down, they look at the Bible.
Yeah.
That's also, we call it presbyopia.
Right.
Where that they can see far, but they cannot able to read near.
Right.
Then at the end, they end up, putting their book or whatever they are reading a little bit far away.
Yeah.
Meaning that the hand or the arm becomes shorter and shorter.
Right. But that is corrected by
That is
just wearing
corrected
glasses.
by glasses.
But this one is different.
This one is
I just
different.
wanted to make sure that at least our viewers are clear on this. All right. Then you obviously were struggling with blurred vision, and you consulted, and what happened next?
Yes, so I went for my first operation in July. So the left one was done first. And after the operation, it was amazing, the outcome of the operation.
Right.
Things appeared new all of a
Yeah.
sudden.
Yeah.
I could clearly see. And when I was, every time when I was driving on the road, all the cars actually looked new. It's like
Right.
a brand new car.
Absolutely. Yeah.
So
Yeah.
that is the difference. That
So was it just on the one eye that you had problems with, or is it both eyes?
No, it was both eyes.
All right. Okay.
So fortunately, I could compare.
Yeah.
I would close this one and use the new eye,
Right.
close this one. So
Yeah.
it was quite obvious
Yeah.
that
Yeah. Tell us about the procedure itself. I mean, the operation. I mean, and how long were you in there for? And so was it uncomfortable? Did it take you long to recover, that sort of thing?
no, not at all. It's a day procedure.
Right.
And what it means is you go to the hospital in the morning, they do the procedure, you go home after a few hours, and it's done under a local anesthetic, meaning they just give a local anesthetic around the eye, and they give you a little bit of sedation. And so it was not
So you're comfortable throughout?
comfortable throughout the
Right.
procedure. I was able to go home after about an hour or 2 hours,
Right.
and I went back to work a week after the operation.
After the first time?
Yes, with a brand new eye,
Ah,
left eye.
that's good. And what impact did it have on your work now? I mean, you told us about the fact that every car was looking brand new,
Yeah.
and the patients?
Yeah, well, in terms of the, my work situation at Steve Biko Academic Hospital, I'm involved in the transplant unit. Now, so when it comes to transplant, when we do transplant, you want to make sure that you shorten the procedure. So if the vision is not good, the operation would actually take longer, and that would obviously affect the outcome of the operation. So, the threads that we use are very small. So after the procedure, actually things are better.
Okay.
Yeah.
And then you say you had you got the first one operated in July.
Yes.
And then how long did it take you to do the second one?
I waited 2 months, July, August. Yeah, I went back 4 weeks ago for the second eye.
Okay.
Yeah, so it's 4 weeks since the second operation.
All right.
And I'm feeling good.
That's wonderful. So any difference between the left and the right eye, essentially?
No, there's no difference.
Well, the reason I'm asking you this, because we saw in the clip, the lady is saying, she attributes this to the fact that it's somebody else that operated on the second eye and not the same one that operated on the first one. So essentially what you're saying is no difference at all.
No, for me, I think both eyes are equally, I can see clearly.
Right. Well, that's a wonderful story to tell. Perhaps you may want to comment on that clip before we let him go. Yeah.
No, remember that everybody has got different eyes in terms of the cataract, and we don't know the old lady if she has other problems at the back of the eye.
Yeah.
If you heard that, she said that the husband had a cataract, and after that they realized that he has glaucoma,
yeah.
and also he is diabetic.
Yeah.
You see, probably also it might find that she also has some other problems at the back of the eye.
Yeah. I mean, we've just listened to this wonderful story. Does it sound wonderful because he's a doctor? I mean, what's your experience with the patients that you operate on?
when a patient comes to you and you are able to help them, as an ophthalmologist, it feels great, you know. And at the end, even patients, they feel great. Some, they will even, you know, old ladies, they will say, you know, my son, if you were not married, I can give you my daughter, you know. Those are the type of things that we can have by hearing, you know. But it's a good feeling. Right. And the only problem that I have is that those patients who are diabetics, those are my worry. Yeah. I know we'll talk about it at some other stage, but that's my worry.
Okay. Well, Dr. Ramzi Maluleka, thank you so much for sharing your story with us, and we can only wish you well in your work and hope that you assist a whole lot more patients with a bright new vision, a bright new world out there. Thank you so much for sharing. All right, time for another quick break. When we come back, we now continue our discussion on cataracts. Please stay with us. Welcome back, and thank you so much for staying with us. We're talking cataract, of course. And before we carry on with our guests, we have a caller on the line, Moses from Cape Town. Moses, welcome.
Hello, doctor.
How are you?
All right, and you?
Good, thanks, man.
All right, yeah. Doctor, this conversation is really very much interesting. I'm a diabetic patient.
Right.
Yeah? So, this problem, cataract, by removal.
Right.
The second eye as well by removal. After a year, but I've got a loose retina, I became totally blind.
Okay.
Then they went and operated me at the eye institution.
Right.
Then after that, I lose retina to the second eye. Right. So now I know my brother as well, because our whole family, institution and operate. I took him to Steve Biko, where Novamo injection here, who stop a blindness. Injection here with 3. Mawana Ile now, it's somehow complicated. So I just want to know what is happening there. Because of our institution, they said they want to operate in injection now, stop a blindness.
Okay. All right. Thank you for the question. Did you get the question? All right. I'm going to ask Dr. Lekhodi to respond to you, but perhaps for the sake of the other viewers, we can just summarize what the problem is.
The patient is complaining that they had a cataract operation on both eyes, and he is diabetic.
Right.
And after they finished, they wanted to do something again on the eye, both eyes, and also he decided no. Then he went to another hospital where they said they can inject an injection into the eye.
Right.
Yes.
Right. So what is going on with this?
Yes. Yeah. First of all, the patient, as I was saying, you know, those are the patients that I'm worried about who are diabetics. Probably what I'm thinking, he was bleeding at the back of the eye. Then they wanted to do an operation, we call it posterior vitrectomy, whereby we remove the blood at the back of the eye because of bleeding. Yeah. At the back of the eye here because of bleeding. Then after that, they are going to do laser. Laser is like they are bending the vessels so that they must no longer bleed. Then that's another option. Another option is we inject a drug, we call it anti-VHF, into the eye. That is going to stop the bleeding. Unfortunately, this drug, we have to inject it on a repeat scenarios. Yeah. It can be 3 times, it can be 6 times until it becomes.
Is that the so-called Avastin?
Avastin.
Okay.
Or Lucentis.
Right.
Yes.
Right. Okay. All right. Okay. So what must he do? He should just wait until he finishes the course?
He must not wait. Yeah. The longer he waits, the more the damage is going to happen into the eye. Yeah. It's either he go back to where he wanted to go, he must go to the hospital or where he feel comfortable, where they can do either vitrectomy or they do what you call anti-VHF. It's just that we don't know the level because the diabetic retinopathy goes in levels.
Okay. Yeah. Let's take another call on the line. Masabata from Soweto. Masabata, welcome.
Papa Likai.
Ma'am.
re teng papa ke re ke nagana le nna ke na le na cataract bane ke na le bona ntho tse ntsho ha ke shebile sometimes o bone ka re maybe ke a wela ha ke tsamaya jwale ke ka rata re bo doctor ba ntse re na ke etse jwang hore ke khone hore e fole.
All right. Okay. Thank you, ma'am. Well, there's another one.
Yes.
She's struggling with her vision. She feels like she's falling as she's walking. And what must she do?
Yes, as she says, she's from right here in Johannesburg. I think it would be good that she can go and see Dr. Kerry nearby so that they can check her, what's happened with her. If she's got cataract, then they can put her on the list for the.
Okay, so she must go to the local clinic to get referred to Helen Joseph Hospital to at least be assessed. Talk about that before we start talking about treatment and screening. We obviously would want to help people avoid this if they can. Can we talk about prevention strategies for cataract, if any?
It's difficult to prevent cataracts forming. It's going to happen, but they do say that exposure to ultraviolet light, and as you said before, smoking, as we mentioned before, smoking, diabetes also accelerates the course of the development of cataracts.
So the idea is to ensure that the diabetes is well controlled.
Yes.
Okay.
Exactly.
Right.
And then, just basically preventing any damage to your eyes, preventing any trauma that you could have, protecting your eyes, wearing sunglasses, will work towards helping, but cataracts will form eventually as you get older and older.
Okay. So there's a probability that there's a lot of people out there walking around with cataracts and they don't know that they have cataracts. Can we talk about screening strategies? Perhaps let's start with you, Dr. Kerry.
Okay, so we have screening programs that we do, outreach programs. There are outreach programs where we go into areas that are not like Johannesburg and so on, where we look at the patients and see if they have cataracts, and then if they do, operate them. The optometrists also are a very good source of screening, so people will go to them for glasses and they will see that the patients have cataracts and then refer on to us. That's the type of screening that we do. And then patients that come into the hospital for something else and complain, then they get referred to the eye clinic and we see them there.
Sometimes, there's a cost involved in screening, isn't that so? People having to pay money to go and visit an optometrist even. How can we make this, or in fact from the department's perspective, how well are we doing in screening, mass screening projects, as it were?
Well, most of the hospitals have optometrists, so the patients get referred there to them. So it's not necessary that the patients have to go to a private optometrist. We do have them at the hospital.
Right. Let's speak to Monica on the line from Velcom. Monica, welcome. Your question?
The problem is cataract.
Right.
After operation, your first eye, it sharp. I had the second eye. After that, he went blind.
Right.
Yes, and I got out when I put a eye.
Ah, is it? Okay. So thank you very much for the question. So I think her father had, an operation. He did the first eye. Everything was okay. After the second eye, he went completely blind. What's the possibility?
There are so many possibilities. It just me and Dr. Kerry is going to be very difficult to respond to.
Of course, we can only talk in general.
We're going to talk in general. First of all, as I said before, it may be something also that make the father have the problem on the other eye.
Yeah.
It may not be only the cataract. It may be also be glaucoma, or what you call macular hole at the back of the eye, or there's a retina as a problem, or optic nerve as a problem. There are so many things that can. And also, yes, the other one that can be on the side of us doctors, whereby we know that there is cataract or any operation, there's a risk. There might be some complication. We are not sure if there was a complication or not a complication, but the doctor will explain it to you. to you
So in this
properly.
instance, I think it's best that, Monica goes back
Yes.
to the doctor or the
Yes.
hospital to get an explanation as
Yes.
to exactly what happened and what,
True
what
that.
the future holds for them.
True that.
Yeah. Let's talk about screening in the private. I mean, we've spent some time talking about screening in the public sector. Clearly, in the private sector, there aren't issues with screening. Who does a lot of the screening? Is the optometrist?
Most of on our side, yes, is optometrist, you
Right.
know, and also the patient just come on their own,
Right.
that because of poor vision.
Right.
And yes, unfortunately, the cost also plays a big role in this type of scenario, and that's why the WHO resolution, you know, they were trying to cap these things of screening, and also trying to reduce the cost of cataract operation.
Okay.
They were
Talk
trying to
about cataract operation. That's exactly what we're going to be talking about in our next segment now. Time for a quick break. When we come back, we talk about treatment of cataracts. Please stay with us. Welcome back. If you've just joined us, we're talking cataracts with our guest, Dr. Alberto and Dr. Lekhodi. And before we start our discussion, we have Ellen from Mafikeng. Ellen, welcome.
Good day, doctor, and how are you?
We're good. How are you, Ellen?
I'm good, doctor. I would like to just check if is it possible that after lens implant, I did cataract removal in June and July.
Right.
So my doctor sent me to the optician for spectacles.
Yeah.
So the optician said my lens were misfitted. Is it possible for that?
Misfitted. Wow. Okay.
Yes.
That's an interesting one. This is the optometrist saying the lens was misfitted. Is that possible, Dr. Lekhodi?
Yes, it's possible.
Right.
In this way that probably the measurement was a little bit unfortunate, because before we put the lens, as Dr. Kerry will be able to talk, before we put this lens, we have to measure you which lens we are going to put inside your eye.
Okay.
Your lens and my lens cannot be the same.
Okay.
Then
So the size is different.
the size is different, and also even for both sides, it can
Right.
be different.
Okay.
Sometimes, yes, you know, the machine can misread. Yes, it's possible,
Right.
but it's rare.
It's very rare.
It's very rare.
Okay.
Yes. But
So
those
what
are the
happens
things-
in that instance where
No,
it
it
was
can be
misfitted?
corrected.
Okay.
It can be corrected
All right.
if it's that, because we've got what you call exchanging of the lens. We
Okay.
just remove that lens and put the lens which is supposed to be there.
Oh, I see.
And
So
that's
it's as simple as that.
As simple as that.
Perhaps it's a good point to start talking about the surgery. Just take us through, even before that, rather. Let's talk in general. I mean, when we look at eye surgery, you know, cataract specifically, there seems to be clear differences between the situation in the public sector and in the private sector. Is the public sector able to cope with the load of cataracts in the country?
Well, there's a backlog in every hospital,
Right.
and there's a backlog. I don't think any public sector hospitals do not have a backlog, but we are trying to get rid of that backlog, and we do that by doing cataract blitzes. In fact, at the moment we are doing one at Helen Joseph, in respect of World Sight Week, and we also try our best to do as much as possible in a day, you know, and that's our main thrust, to try and do as many cataracts, and we're doing well. We've brought our waiting time and our backlog down quite a lot in the last few years at our hospital.
When we started this program, we showed a clip there by OBIS, and there's other non-governmental organizations that go around the world, especially in the African continent, to assist people. Do you have partnerships with any of these? Perhaps Dr. Lekhodi can comment on that?
Yes, we've got them. With Orbis, Orbis is the flying hospital.
Right.
They fly to different types of countries in Africa, mostly. They land, they operate, and they leave. Then in South Africa, our society, Ophthalmology Society of South Africa, it has what you call right to sight, whereby private doctors are also helping to eliminate or decrease
the backlog
of the cataract in the country.
We just are not doing enough.
We just are not doing enough, but they are doing their best. That's why we've got a eye week or eye month. That's the time where there's a marathon of cataracts being done all over in the world.
All right. Let's take our last caller in this segment, Lindy from the Eastern Cape. Lindy, welcome.
Good evening.
Hello, Lindy.
I'm starting to be blind at some meters or 1 meter. It's just dusk. Uba liru 2 years old, 2 meter. I keep on 100 meters.
All right. Okay.
I think it.
Okay. All right. Okay, Lindy, I think you need to go and consult your doctor because you need to be assessed. You may be having a cataract. What Lindy is basically saying is that within a meter or 2 meters, everything is blurry. She's struggling. Would you concur with that?
I mean, it may be also she's short-sighted.
Yeah.
And it probably can be corrected by spectacles.
Okay, so she needs to
she needs to go and consult so that we can give a proper solution into that.
All right. So before we run out of time, our viewers are probably eager to know what actually happens in a cataract, surgery. How do you remove this cataract and replace it with an artificial lens, so to say?
Okay, so first of all, we also do the cataract under local anesthetic, and it's a day case.
Right.
And basically what we do is we remove this cataract, this cloudy cataract, and we put in a cataract with a lens. So we start off here. We make an incision between the cornea and the sclera, as I mentioned before, and we go through the pupil into the back of the eye, into the anterior, posterior chamber, through a dilated pupil. Then we make an incision. Let me use this one. An incision in the anterior capsule of the cataract. The cataract has the lens, the anterior capsule, the cortex, and the nucleus. The nucleus is inside. The cortex is this white, fluffy material. We'll make a circular incision inside on the capsule. Then we will emulsify the lens. So we use ultrasound probe. Some
sophisticated equipment.
Yes,
to suck it out.
To make it fine and then suck it out.
Right.
And then when we have the lens that is now clear, we implant a lens into the bag, which we've got a bag left. We don't have that white material anymore.
Right. Okay.
We implant it into the lens, and then this is also correcting and is still putting the light rays onto the macula, so that the image is clear.
Okay, and you say that it takes place at a day hospital, or it's a day procedure?
It's a day procedure. So
and how long does the actual procedure take?
Well, it depends on the surgeon. It can take from 10 minutes to half an hour, sometimes a bit longer, but on average 20 to 30 minutes.
Right. And then after surgery, what then happens? I mean, the person, how long does it take to recover completely?
Well, generally we let the patients go home, or they sleep over in the hospital. The next morning we take off the iPad, and sometimes most patients can see and it's fine, and then they go home. When they go home, they have to remember not to rub the eye. That's basically the thing. Bend forward, or do anything that might sort of damage the healing, because the wound is still healing. Yeah. But generally, the recovery is very quick.
Right. Back to you, Dr. Lekhodi. I mean, I know that you're a busy man. You've been traveling. Just now, you arrived only this morning from way far away, a place called San Francisco, if I'm not mistaken. And I see you've got something on your jacket. Just tell us a little bit about what that is.
This, I just got an achievement award from American Academy of Ophthalmology for bringing them attention about what's going on in Africa, so that we can assist Africa in terms of helping them in the same things that we are talking about, cataract, and how can Americans help. We've brought a lot of our colleagues this side so that they can able to operate in some undeveloped countries, DRC, Zambia, Zimbabwe. Those are the things that we are looking at. That's the reason why I'm so glad that we are going to have WOC, World Ophthalmology Congress, next year, 2020.
Well, congratulations from all of us here at Health Talk and your achievement, and we're looking forward to this WOC 2020 to be held next year in Cape Town. And to you, Dr. Alberto, thank you so much for your contribution. We really learned a lot from you. And of course, earlier on we had Dr. Maluleke, who also shared his story. Well, that's all we have for you today. And we're back with you again in a week's time. And yeah, same time, same place. Until then, please do take care.